Good afternoon, everyone. This is Pierre again with another episode of Pierre Speaks, your wellness edition. I am making this video as a companion piece to the last video, which was regarding chronic pain. This one will be about prescriptions. Now, the part that prescription plays in chronic medication, in chronic pain, is that most of us who are in chronic pain have been on or are on some sort of prescription, multiple prescriptions. I've had in the last 8 years, I've had 4 surgeries. My knee, my neck, and 2 lumbar surgeries. And these were the first surgeries I ever had, which the first one was my knee. And I really wish that I would have been like maybe taken through some sort of, in the pre-admission testing or something, they would really give me an idea of what to expect after I'm out of the hospital, because no one did. And you know, with everything they pump into you intravenously, the medication they pump there, and then what they give you after you've left the hospital to manage, you know, pain you may feel, they don't really give you an idea, at least in my experiences, of what to expect from the medication side effects. And for me, after that knee surgery, I got home and it was about a week, and I noticed my stomach was hurting. And I just didn't know why. I wasn't really eating much, but it was a persistent stomach pain. And then it dawned on me that I hadn't gone to the bathroom to relieve myself in any of that time. So it was a week. And I was just like, wow. So, you know, I had to take care of that. But, you know, it's just something that I wish I would have been ready for, because I certainly wasn't. But the part that's the most important about this is that fast forward 7 years later or 8 years later, and I would say that my digestive tract wise, I haven't been the same. It's very, very different in terms of regularity. And I get fiber daily. I eat roughage. I have all those things that you should be getting your diet to help your digestive system come along. But what I've come to understand now is that peristalsis is the movement of food through your digestive system. And these prescriptions have really slowed this down over this time. And I don't take medication consistently. Now I'm at a point where I won't even take it unless I'm having a really, really bad day. But, you know, this is something that I really caution anyone to consider. And it's so pronounced now because at the rate they prescribe medication, I've seen commercials. And there's a name for this thing. It's opioid-induced constipation is what it's called. So it's that pronounced where they're giving out all these drugs, and so many people are complaining about being constipated or not being able to relieve themselves. And you know, I had no idea it was a thing, but here I am I probably see a commercial once daily about this. So again, this is something that you really should know before you embark. I mean, I'm not saying that you shouldn't have surgery because of it, because most of the time we have surgery, I would say it's not elective. But, you know, if you do, really talk to your doctors about it prior to it, because it's something that can have a lasting impression on your quality of life. It definitely has for me. A lot of the people that I meet in this field, a lot of clients that I've met or a lot of clients that I talk to, they have some sort of back problem or knee problem or something like that. So I come across this all the time and speaking to people who are on various medications, and you know, I try to let them know. I will never tell anyone to not take medication, but you know, my disclaimer for this is that these are my experiences, and you know, from more than just about maybe a decade of it, and how it can affect you in the long run. So, you know, I'm not anti-medication, I'm not anti-prescriptions, but I just think that try everything you can. You know, to go through the palliative medicine hierarchy and definitely do what they ask you to do in terms of all that other stuff if you're okay with it. But, you know, with the medication, I would not look into medication lightly. That's the thing I guess I'm ultimately trying to say, is medication may seem, it's so easy because, you know, people go to the doctor, can you give me something to make me feel better? Here, take these, hand them out. And it's easy, and you're looking to be alleviated or relieved. It's just not always so easy. There's a cross to bear when going with that, because, you know, you can look up any medication and it'll have a list of side effects, and you might look at those side effects and say, it's not too bad. You know, this might make me runny nose or something like this, and might get a little bit of insomnia or something like that, and it's not a big deal. But the thing is, you might look and there might be 12 listed symptoms, and the thing is, you might get 5 or 6 at a time, and cumulatively, that's a heck of a lot to deal with, and it's much more unbearable than just dealing with a little bit of a runny nose or just having or possibly having diarrhea as an offshoot of taking a medication. But put 3 to 5 of those things together, and it's just kind of as miserable as what you were trying to fix. So, but that's my experience, and that's my cautionary tale to anyone who is on medication or who might be having an upcoming surgery or something like that. Talk to your docs, keep the communications open, and see if there's alternative medications, because some medications are definitely not as harsh as others. But you know, look into it if you have to. But this is Pierre Speaks, and I would ask you to, as always, like, subscribe, comment, and let me know what you think. I thank you again for viewing, and you take care. Be well.